Good afternoon, everyone. This is Dr. Bhupesh from Dr. BKM Institutes, and today we are doing reading questions. So please subscribe our channel right away if you have not. And now taking on to the question itself, question number 3 that we want to discuss, and question number 4. So I'm just going to go through these questions. So question number 3 says, what is being described in the section of guidelines? So always read the question first. What is being described in the section of guidelines? So I have read the question. I'm just going to go to the paragraph now. After that, go to the paragraph. Patient admission. If the patient medically requires hospital inpatient services and the physician believes that the patient will need to stay in the hospital for at least 2 midnights, the physician should order inpatient admission. So basically, physician will order inpatient admission if patient will stay for 2 nights. If the patient does not medically require inpatient hospital services or the physician does not expect the patient to stay past 2 midnights, the physician should order observation outpatient department services. So obviously we know, so basically they are saying OPD less than 2 days, 2 nights, and IPD more than 2 nights, at least 2 nights. That is what they are saying. Basic that we already know. Make it very simple and try to relate it with your practical examples. Then it will become easy. Then the certification must be signed and documented in the medical record prior to the patient discharge. So always there should be a certification. If the patient is discharged, then it should be in the medical record. Hospital may choose to have physicians record these elements of the certification either on a specific form or throughout the medical record, such as in orders, history, physical. So basically hospital may choose to have physicians record these elements. So basically physician को ये सब कुछ record में डालना होता है either on a specific form or throughout the medical record such as in orders, history. इन सब history में भी patient क्या आना चाहिए, orders में भी आना चाहिए, physical and physician progress notes. Guidelines. Excellent patient care should continue to be the top priority. Document the diagnosis, medical rationale, प्लान ऑफ केयर, एंटिसिपेटेड डिस्चार्ज. तो पेशेंट के बारे में क्या क्या रिकॉर्ड करना है, डायग्नोसिस, मेडिकल रैशनल, प्लान ऑफ केयर, एंटिसिपेटेड डिस्चार्ज. साइन द एडमिशन ऑर्डर एंड सर्टिफिकेशन प्रायर टू डिस्चार्ज. तो प्रायर टू डिस्चार्ज. सो इफ आई गो टू द ऑप्शन, अभी वी हैव रेड सो मच. If you want to make it OET easy, if you want to make OET reading easy, so have we talked about any changes? If I go to the paragraph, there are no changes. There are no changes. So this cannot be my answer. So this is what I say is elimination method. Don't do this as answer. Best practice procedure. Yes, it can be the best practice procedure. Exception to the procedure. There is no exception. There is no word like exception in this particular paragraph. So if there is no exception, I cannot find any exception. I can, so two answers are anyhow wrong. So the only option that I'm left up with B. So B should be my answer. So this is how you do OET reading in the simplest of way. Thank you.